basically saying, can I do like a nuts and bolts? What do you need to know from exercise and Parkinson's disease? I think this year has been really hard on a lot of us. A lot of us have kind of fallen off the wayside in terms of their exercise. So I think this is a great time to get back to it and kind of review what you should all be doing, whether it be at home or in a gym or in a community class. So for those of you from the business world, you'll understand this why, how, what model. But I kind of thought I would use this as my overview. So why is it important to exercise? What is your purpose to exercise? How, this is where we're going to spend a lot of time of the process. So specifically, what exercises should you be doing at this point? And the result, given all of this, what are you actually going to do? And I think that's a perfect lead in for Nate, who's going to talk to us later about barriers to exercise. Because I think a lot of us are going to sit there today and be like, yeah, this all sounds great, but how are you actually going to get out and do it? And Nate will kind of discuss that after I'm done. So why should I exercise? This is for all of you that have Parkinson's, but also potentially your care partners that are listening that don't have Parkinson's. This is just kind of exercise 101. So bones, bone density peaks between the ages of 20 and 30s. So for the majority of us on this call, we are on the great decline of bone density. And the risk of osteoporosis is going to increase significantly as we age. Unfortunately, Parkinson's plus osteoporosis is a big problem in terms of fracture. The good thing is exercise is going to increase your bone density. So strengthening, high impact, jumping types of exercises are really going to make a change on your bones. So it's important from a bone health perspective to exercise. Muscles, again, sad news. We kind of hit peak strength in our 30s, and then we start to lose about 1 to 2% of muscle mass by the age of 50 every year. So again, just the act of aging, this isn't including Parkinson's, you're going to be losing muscle strength. So 1 in 3 adults over the age of 80 have lost about 50% of their strength. But again, this is totally reversible. We just have to work a little bit harder and we can increase that strength. Cardiopulmonary, still the #1 cause of death in the US. I'm not going to get into COVID right now, but we got to keep our hearts and lungs fit, so to speak, as we age. So as I tell people, worst case scenario, if exercise doesn't do anything for the brain, which I'm going to argue we now know it does, I don't want you to die because of heart and lung disease. So again, exercise can improve your lung volume, exercise can improve your heart function. So I think that's important for all of us to be able to exercise. So in terms of brain, the majority of these studies are done in animal models. Unfortunately, a lot of this is just really hard to research in people's brain, although technology advances with FNIRS, where they can kind of look at blood flow in the brain, kind of like how they do pulse ox when you go to the doctor. fMRI and that kind of stuff is starting to show this as well. But there's obviously an increased blood flow to the brain when you exercise. So as your heart starts pumping, that blood's going to go up and potentially going to even make new blood vessels. BDNF is kind of this buzzword when you talk about exercise and Parkinson's. So this is the brain-derived neurotrophic factor. And this is this whole idea of if we exercise hard enough, is it neuroprotective? So again, this is really hard to study. You can get plasma levels, so they can take blood and look at BDNF, but they're not sure if that is the same as the amount of BDNF that's in your brain. So the majority of BDNF studies are in animals. Neuroplasticity, what is that when we're talking about that? That's actually neurons that are making new connections. So just like blood flow, you can have new blood vessels, that's angiogenesis. Synaptogenesis is the creation of new connections in our brain. So again, our brain's really, really big, but if there's not connections between the right side and the left side from the basal ganglia and through the rest of the brain, it doesn't matter how big your brain is, you need it all connecting. So the thought is, if we exercise, maybe we can develop better connections. It's been shown to have increased volume if you exercise. So unfortunately, as we age, brain volume decreases, but some of that can be offset with exercise. Dose effect on exercise of neuron count. And I'm going to kind of talk about this a little bit, but the more you exercise, the better your brain looks on a slide. And I think, again, that's going to be animal models or for people who have passed. The important thing is, irregardless of where you are in your Parkinson's journey, it's important to exercise now. So this morning in clinic, I saw someone who was doing great. And I said, our goal for you is to keep you doing great. For those of you who aren't doing great and want to do better, I think it's still okay to start exercise, and hopefully we can rewind the clock a little bit. But we really want to protect the neurons that you have left and protect your function as much as we can. So all of that is specific to anyone who's on this call, even Nancy, who exercises hours every day as she teaches all of her classes. For those of you with Parkinson's, these are kind of common things that most Parkinson's patients will experience. So rigidity, that stiffness that you have that often can kind of create that forward posture issue. I think rigidity and posture are often kind of combined. Gait and balance problems. So this is the short and shuffling little walking steps. Balance problems can result in falls, instability. These are things that the neurologists really struggle with because they don't always respond to medication or deep brain stimulation. Functional mobility, the getting up and out of the chair, the floor, the bed, and also pain. So these are all reasons that probably Nate, as well as myself, will see patients in the clinic. So the great thing is exercise can help with rigidity. You can do stretching and it can kind of relax your muscles. It's going to be short term, but short term is better than nothing. Exercise can improve your posture. There's exercises that we can do to keep your head up tall and your shoulders back. Exercise can make your walking better, can improve your balance. Exercise can decrease falls. Exercise can improve your mobility, and exercise can decrease pain. So again, these main reasons that we'll see patients in physical therapy, I think all of those can be treated really well with exercise. There's also a big discussion of non-motor issues. So all the things I just covered were kind of the motor issues that oftentimes a neurologist will talk to you about. Fatigue. Fatigue is a huge problem, with the majority of patients with Parkinson's reporting issues with fatigue. That's been shown to improve with exercise. And this is a huge buy-in with patients of, but I'm so tired, I don't have the energy to exercise. And unfortunately, it's an energy in, energy out thing. So even if you can start doing a little bit, oftentimes people will report an increase of energy afterwards. And I've seen that in clinic, and it's also been shown in research. Sleep. Sleep is a huge problem with Parkinson's patients. They can't fall asleep, or they fall asleep fine and then they wake up numerous times and can't go back to sleep. Studies show 150 minutes of moderate to vigorous exercise per week can improve sleep up to 65%. Unfortunately, these improvements were not shown with mild exercise. So we're going to talk a little bit later about intensity of exercise, but I think this is a common theme that's coming out on the research of it needs to be intense in order for it to make a change. And then memory. Unfortunately, a lot of Parkinson's patients are going to have memory issues. A lot of people as they age are going to have memory issues. But exercise also can improve one's cognition, one's memory. And I think this is something that we all hold very, very dear to us, that we don't want to lose our mind, our ability to remember grandkids' names. So this is another reason to get out and exercise. Nate's going to talk about apathy. Mood issues are a big problem in Parkinson's. It just kind of goes with the pathology of Parkinson's. So depression is a huge obstacle that I find and is directly related to quality of life. So these are kind of points of exercise can improve pain. Exercise can increase endorphins. Both of those can kind of help uplift and improve your depression. And one study found 3 times a week for 16 weeks, which unfortunately is a really long time when you're expecting an immediate improvement. People started on 20 minutes, went up to 45 on the treadmill. had a reduction in depression. Again, 50% of their max heart rate up to 75%. So it needs to be fairly intense. With all of this said, I personally believe if depression's a huge issue, I've kind of talked to my providers, I think the best result is when we kind of get this combination of having a referral to physical therapy to get you started on an exercise program and seeing a psychologist at the same time. I know trying to get in with a Parkinson specific psychologist is a big issue, but I think even any psychologist to kind of help talk through at the very same time of cardio exercise is a powerful, powerful combo to help that depression, which can again be a barrier to exercise. So for those of you who've heard me talk, you've probably seen this slide before. I love this slide because I think it's, again, exercise is this really exciting place right now in Parkinson's, but I don't want to oversell it. So on this graph here, I'm going to kind of switch screens. We've got this black line right here, which is a quote normal or healthy aging person. On the x-axis down here, we have age. And on the y-axis right here, we have how much dopamine is in your brain. So we can see for someone who does not have Parkinson's, there's an overall decrease in how much dopamine is in the brain. So some people postulate if we all live to be 200, we would all end up with Parkinson's. So then for some reason, many of you have Parkinson's. Why that is, I'm not going to even start to get into that. It's not the scope of this study. But the question is, if you were to start exercise early in the disease, could you shift when you get Parkinson's? So shift this from 65 to maybe 70 or 75 years old. Or if once you get Parkinson's, you were to start exercise, could you shift the curve up over a little bit to potentially change how much dopamine's in the brain and shift when you die? And I think the important thing is there's question marks on the majority of these. Again, because we are where we are right now with this disease, we don't have a great test. We don't have a great marker for Parkinson's. There's so many amazing researchers that are working really, really hard on that. But the only way to really answer these questions in terms of how much dopamine is in your brain is on autopsy. And there's obviously a good reason. None of you want to donate your brains while you're still alive and well. So as you're exercising, we truly don't know what's happening in the brain. So the studies I'm going to talk about, obviously I work in a gait and balance lab. Those are things we can easily measure. Some studies are starting to look at the UPDRS thing. So looking at how your hands move, what kind of tremor you might have. We can measure those things and get this idea of how the brain is actually working once we do intense exercise. But I think it's important that we realize the science of this is still fairly new. And I can't promise that if you exercise hard enough, I'm going to take away your Parkinson's. I can't promise that if you exercise hard enough, we're going to stop your Parkinson's. It's still a neurodegenerative disease. Our best case scenario is that we're basically shifting these curves. And as I say, hopefully slowing down that decline. So over time, your dopamine's going like this. And maybe what we can do is it'll still be a downward slope, but we can change how quickly that decline is happening. So summary of the why. This was came out of a paper out of Boss Bloom's group, who does amazing research on Parkinson's and exercise. There's all these benefits. Why should we exercise? Because you're going to be more fit. So again, your heart and lungs are going to be healthy. Your UPDRS score, which we're going to get into in a little bit, that's what the neurologist does with you, potentially is going to go down. Your motor symptoms are going to go down. Your health quality of life is going to go up. Your non-motor symptoms, so sleep, depression, those types of things are going to improve. Disease modification, great big question mark. To be determined. Why don't people exercise? is a great question. Some people, it's fear. Well, if I exercise too hard, am I going to give myself a heart attack? If I exercise too hard, am I going to fall? So those are kind of hazards and threats. And I think it's important to consider those. And I think sometimes when we're talking about high intensity exercise, if you're really scared about cardiovascular, talk to your primary care doctor. We have the ability here at OHSU, and I'm sure the other hospital systems too, have the ability to really look at what is your maximum heart rate, in which case you exercise on a treadmill or on a bike, and they can measure that. And so when some of these studies started coming out, I talked to our main physician that does that and said, would you test our Parkinson's patients if they really are scared? And he's like, absolutely. It's a little bit of a nuanced thing for insurance, but usually at this age, there's enough potential issues that they can get it cleared by insurance. So what we'd like to do is make you feel less concerned about these and get you over into looking at the benefits of exercise. So all that sounds great, but now how? So starting place, the World Health Organization suggests at a minimum for older adults, which they consider over the age of 65, should have at least 150 minutes of moderate intensity exercise a week or 75 minutes of vigorous intensity a week. So that's what the World Health Organization is saying for people without any issues whatsoever. For those of you who are under the age of 65, it's double that. So likely all of us need to be doing a lot more, I'm going to guess. I found this fascinating article which talked about the history of Parkinson's and exercise. Nate and I are, I'm not going to say the same age, I think I'm a few years older, but we graduated PT school at the same time. And I think he can probably agree, in the last 15 years, it's changed dramatically. I remember when I very first started, everybody got this green book from the Parkinson's Foundation that was seated stretching exercises. And that goes back to the late 1800s when a paper wrote, life should be quiet and regular, freed as far as many can't, freed as far as many be from care and work. And that was theoretically the cure for Parkinson's and exercise. We just wanted you to sit back in that chair and be nice and relaxed. Family and friends could do all the work from you. And that theoretically would maybe decrease your tremors. It'd probably decrease your anxiety, just make you nice and relaxed. So that was where stretching and chair exercises came about. And you have to realize back then there was no treatment for Parkinson's. And if any of you have ever worn off, maybe your DBS has stopped working, maybe you've lost your meds on a trip or a refill hasn't happened, you probably feel pretty crummy, and maybe that would be appropriate if you had no medications. But 1975, carbidopa-levodopa became commercially available, and that really changed the lens on Parkinson's. Instead of a disabling disease, that brought people back to life. So then in the 2000s is when animal studies started showing high intensity exercise may actually be neuroprotective. And again, that's where I think things really started to shift a little bit. Of Parkinson's patients are not these feeble little people that we should get wheelchairs and be kind to and give massages to. Parkinson's patients are capable of a lot, and we need to be pushing them. On the graph on the bottom, you can see over time on the x-axis, the year, and then the number of publications. So in the 1970s, 1980s, all the research was done on medication. And now there's been this shift with the green line of exercise that's really been coming up again, kind of starting in the 2000s. And this is only until 2010. So my guess is that line is even higher. So it's an exciting time for Nancy to invite Nate and I and kind of shake things up because science is changing quickly. So types of exercise is kind of broken into these 4 areas: aerobic, strengthening, stretching, and balance. The recommendations I'm going to go over are kind of hot off the press. This is, there's a big PT conference that happens annually. This year it was done virtually. American PT Association puts it on. And this year, there was a group of therapists that combed the research and came out with what's called a clinical practice guideline. So a lot of these recommendations, this is not even published yet. They're hoping to get it published sometime this year, are going to be based on this. So again, this is brand new, based on science and different studies. So aerobic, what are the benefits? There's really good research. Again, it's going to improve your lungs. It's going to improve your motor severity. So it's going to improve how you feel, and it's going to improve your walking. There's moderate research on the other stuff, non-motor symptoms, balance, quality of life. Risks and harms. The studies basically say if you start exercise and you haven't been doing a whole lot, there's a risk that you could hurt yourself. So I think this is where the slow and steady is kind of important, and it's important that you pick the right mode. Just because the study says people walked quickly on a treadmill and did really well, that may not be appropriate for you. May not be appropriate for you with your orthopedic injuries, may not be appropriate for you where you are in Parkinson's. So the first study that showed this was called the Spark study. This came out a couple years ago. It hit the New York Times, got a lot of press, got a lot of questions. It was newly diagnosed people with Parkinson's. So studies like newly diagnosed, just because you take the medication portion out of the equation. So you don't have to worry about changes in medication over time. They did high intensity treadmill 4 times a week for 26 weeks. So they broke it up into 3 different groups. Usual care, continue to do what you're normally doing. Work out on a treadmill, 60 to 65% of your max heart rate, and then work out on a treadmill 80 to 85%. This was a phase 2 study, which is a safety study, in which case they found no serious adverse events, which is great. Nobody had a stroke. Nobody had a heart attack. There was some musculoskeletal injuries, which you would expect when people are starting an exercise program. The exciting thing is the graph, which is the UPDRS. So again, there's a lot of spread in the data. There's not huge numbers in this. There's not a lot of people. And they didn't follow people very long because it was just a preliminary study. But here you can see usual care. So over time, people got worse. Their UPDRS went up, I'm going to say about 3 points. Usual care was the same as working at a moderate level, which is 60 to 65% of your heart rate. So there was almost no change between these 2 groups, which when this paper came out made me a little bit sick to my stomach because I realized I'd probably been underdosing people this whole time. There was a trend for a net neutrality, so no change in UPDRS for the people that had been working out at this 80 to 85% of the heart rate. So this was this major shakeup of we need to be pushing people, and there may be this neuroprotective effect of, again, you see your neurologist every 6 months. They do that test where they look at tremor and stiffness and hand motions. And over the 6 months that people were exercising really intensely, they didn't get any worse. So again, lots of questions from this. They're making a much bigger study that's going to be multi-site. They're going to follow these people for a couple of years. This is called Sparks 3 because it's a phase 3 study. OHSU is a site, so I put up the email if you're interested. With that said, it's for newly diagnosed people that are not on medication. So for those of you who are not newly diagnosed, great. You can do it on your own. You don't necessarily need to be part of the study because the recipe is basically right here in terms of exercising really intense. When the lead researcher came out to OHSU, I said, well, that's great, but I see a lot of people who can't walk safely, quickly on a treadmill. What about a bike? He said, great question. We should do a study. Well, Boss Bloom's group did a study and basically found out that they were similar. So here they were on a stationary bike at home. There was feedback. So I think the feedback is really important because people tend to underdose themselves. So there was a software program that kind of provided virtual coaching of go faster, go harder. 30 minutes of aerobic with a cool down and warmed up 3 times a week. And here they kind of found the same thing. So the top is the aerobic intervention, and then the bottom is the active control. Over the 6 months, there was no change in the UPDRS score for the people who biked intensely. Or the active control, there was slight worsening of the UPDRS. So again, this is super exciting stuff. So you're all sitting there and you're like, great, what should I do? My general line is if it's easy, it's probably not doing you any good. So you need to start pushing yourself. With that said, there's this balance between I'm going to push myself and I'm going to hurt myself. So this is where I think potentially working with an exercise trainer, working with a physical therapist is a good idea. Also, I like a slow increase in challenge or an interval model. So if I told you, I want you to go out and exercise at this 7 to 8 borderline uncomfortable for 30 minutes and you guys aren't exercising, there's a good chance you're going to get hurt. But if you're exercising and feeling pretty good at a 2 or a 3, you could do this for a couple of minutes and then you could pop up to a 4 to 6 for a couple of minutes and then pop back down. So kind of interval between these two, and over time, make your time that you're at the moderate level higher to the point that you're at 30 minutes. Then you can start doing intervals between moderate level and vigorous activity and slowly bounce your way up. A lot of these studies also are on max heart rate. So I kind of put an equation on here if you want to do it on yourself. The one hesitation I have is sometimes heart rate can be hard for Parkinson's patients because Parkinson's does affect the autonomic system. So a lot of my patients aren't able to get their heart rate up as high as this would indicate. So for a 65-year-old, they should be exercising probably 130 beats per minute. I've got some really fit individuals and they can't get it over 115. And again, that's because of Parkinson's has just blunted their heart rate. So that's where I like this RPE scale. Again, on a scale of 1 to 10, our goal is 30 minutes at 7 to 8, but it may take you a while to get there, and that's okay. One thing with Parkinson's is you have time, as long as you start increasing the intensity now. So overall, how are you going to do aerobic? Consider intervals. Your goal is to make you sweat. So if you're not sweating, you're, again, probably not working hard enough. And on a scale of 0 to 10, try to get up to a 7 to 8. There's so many different ways to do this. You can do walking. You can walk outdoors. You can do a recumbent bike. I'm a big fan of. If you're already doing an outdoor bike, that's fine. But for those of you not doing an outdoor bike, I'm going to suggest you don't start unless you talk to someone first. But realize with walking, quality over quantity. So I'd rather you do hills. I'd rather you maybe walk with weights than try to walk really, really quickly and not walk well. And here's again the dosing. So this comes from the studies. You want 3 times a week. You want at least 30 minutes, and it needs to be moderate to high. At this point, from a study perspective, no one form of exercise is better than the other. So again, what's the best exercise for you? The exercise that you'll do. So it can be walking, it can be biking, it can be one of the various forms of exercise classes that's available, you know, at Pro or in the community. As long as your heart rate's up, you're doing benefit. So I'm going to switch gears to strengthening. Again, there's good evidence that it's going to improve your strength, your power, your non-motor symptoms, function, and quality of life. There's a risk that you could feel a little sore afterwards, which is not surprising if you guys have ever done any significant strengthening before. How? One thing that I like to kind of focus on here is nutrition. So I know protein is really hard for a lot of you, but you need to be having good nutrition if you're going to improve strength. So I know there was some questions about I just seem to get weak. We know Parkinson's patients have problems with weakness. That's a complicated field that I'm not going to get into, but Parkinson's itself can affect your ability to do muscle contractions. Plus, I think there's just a lot of disuse that can happen. But if you're going to build strength, you had to have good nutrition. So definitely maybe talk to your provider. Ideally, you're spacing your protein out at least 30 minutes before or after you take any of your carbidopa, levodopa. You want to focus on extensors. That means your butt muscles, your thigh muscles, and your back muscles. So Parkinson's tends to pull us forward. These are muscles that are going to help straighten you out. You want to make sure you actually get to fatigue. So again, a lot of people will pick up 2-pound dumbbells and do some bicep curls and say they did strengthening. If you're not so tired that you can barely do that 10th rep, you're probably not pushing yourself hard enough. So you really need to feel it. And when I say that, you should feel it in the muscle and not in the joints. So people that have knee pain when you're doing squats, I don't want you to feel it in your knees, but you should be feeling a really strong burn in those thigh muscles. So you can do this with free weights. You can do this with weights and machines. You can do this with bands. You can do this with your body weight. You can see somebody's not doing planks. So this can be super simplistic or it can be super fancy. You don't necessarily need a gym for strengthening. And again, here's the dosing. 1 to 2 times a week is what the studies indicate, but this is going to take a lot of time. So it takes months to build up strength. So realize that you can't just like go to the gym a couple times and get frustrated that you're not making any gains. 30 to 60 minute sessions. For strength, you want more weight than for power. And ideally you increase to 3 sets of 15 reps. Going over to stretching. The goal here is to maintain range of motion. So one of the fundamental problems with Parkinson's is it makes you really, really tight. So here we're going to try to work on stretching the muscles that get so tight. And this can help a lot with posture or pain. Most stretches you're going to want to hold. So you're going to go into a position, you're going to hold there and just breathe. In terms of dosing, there's no current evidence-based recommendations. So the practice guidelines said, everybody says we should do it, but there's no studies out there. And I think sometimes it's important to realize no studies doesn't mean negative studies. I personally recommend you do it every day. So Dr. Nutt, who is one of my favorite neurologists, he says you have Parkinson's 7 days a week, therefore you should exercise 7 days a week. I think we all need a little bit of a break, but I think some stretching should happen every day. And usually people like it because it feels good. Ideally, you can kind of sprinkle it in throughout the day. I love foam rollers. I feel like they should be in everybody's homes because they just do so much for posture. And yoga is a good way if you just get bored with plain stretching. Yoga is a great way to kind of get stretching into your program. Balance and agility, great evidence for this. Definitely has been shown to be effective. With that said, there is a risk of falls. So as you're doing this, I think it's important you think about where you're going to do it. Exercise focused specifically on the problems with Parkinson's. So a lot of people have basically looked at what kinds of things are wrong with Parkinson's and designed exercises around them. This is another way you can get aerobic exercise. So I kind of put examples of boxing. I'm sure a lot of you are in the boxing programs, dance, Tai Chi, ball sports, pickleball has taken over tennis courts all over Portland. I reached out to Nancy earlier to see if maybe Pro would sponsor some pickleball events, but I think this is a fun way to work on balance and agility. I know Nancy and some of the trainers around will work on footwork drills in terms of ladders. I'll do that in clinic. Some of my patients have gotten it. So balance and agility, I feel like the world is your oyster in terms of options. Studies indicate here you should, again, probably be doing exercises at least 2 to 3 times a week. It's going to take a month or 2 to see changes. The intensity has to be a challenge, which sometimes means if you're a fall risk, you got a buddy who's going to spot you. Ideally, you're going to do exercises that have different sensory conditions. So that means sometimes your eyes are going to be closed. Sometimes you're going to do it on a wood floor. Sometimes you're going to do it on a carpet floor. Sometimes maybe you'll do it outside on grass. Ideally, you can include some strengthening in here. Again, squats and lunges are a great example. walking in different directions. And because of that challenge, a supervised exercise program is likely more effective. If people are exercising totally on their home alone, sometimes you're going to be underdosed and may not get as good of gains. So switching gears a little bit, exercise and Parkinson's special considerations. Balance and falls, trying to challenge yourself in safe conditions. So sometimes this means standing near a wall or a counter or a chair or having somebody next to you or doing it in a class. Orthostatic hypotension. This is a huge problem with exercise. People are dehydrated when they come in. Then we start exercising them intensely. They start sweating and they get really lightheaded, especially as they go down to the floor and get back up. So make sure that you are hydrated going into your exercise. Make sure you take your water and drink throughout your exercise. And if you get lightheaded, don't try to push through. Sit down and let that blood pressure come back up. And then pain. Stretching is super important to do. So I think not pushing through the pain. So listening to your body, just because you're in pain doesn't mean you don't exercise. But on the other hand, not pushing past the level of pain. In terms of pain, there's 4 different main types of pain that Parkinson's patients will have. And all of these include, for treatment, graded exercise programs. Whoops. Except for visceral pain. So this is pain that likely exercise is not going to have. So if you have central pain where your body's just upregulated, which happens with Parkinson's, exercise is going to help. If you have peripheral pain, so this could be because you have neuropathy. This could be because you have a pinched nerve in your back. Exercise is going to help that pain. If this is because you have musculoskeletal pain, so this is the most common type of pain, oftentimes from arthritis, exercise is going to help that pain. So again, pain should not be an excuse of why we should not exercise. Pain is actually a reason to exercise. What happens if you're having a bad day or your meds aren't working? Should I still try to exercise? And the answer is yes, but you may need modifications. So if the choice is, should I ride my bike or should I not ride my bike? I'd rather you ride your bike at that 60 to 65% of your heart rate or a 4 to 6 out of 10 than not ride it. And maybe you just aren't as exercising at that super high level. Same thing with strengthening. If it's really, really painful, decrease your weights, decrease how far you're going to move in all of those directions. Stretching, absolutely, you should do even if you're off. And agility, again, I kind of joke, we all have good days and bad days. With Parkinson's, you also have good times and bad times. If you're having an off time, that's the time to ask for a buddy to maybe spot you. That's the time to maybe hold on to your walker, hold on to your counter while you're doing the exercises. Most people have pretty good insight. And I say just take an extra precautionary measure for safety, but continue to do those balance exercises. Principles of general exercise, do something you want to do. So just because I talk about treadmill and bike, that's what the studies are. If you want to do Tai Chi, you do Tai Chi. You're more likely to stick with it if it's something you want to, if you enjoy doing it. Consider getting a baseline. What are you doing now? And what do you want to be able to do in 6 months? So that could be a PT assessment, or it could be an assessment of what you're doing right now. You know, look at your Fitbit, look at your pedometer. How many steps are you doing right now? How many steps do you want to be at? Avoid the cycle of overshooting and undershooting. The last thing I want is for you guys to get really excited by this talk and go out and run a 5K and then not be able to get out of bed for 3 days. Or after this, sign up for 14 different classes and then again, be so stiff and sore that you can't get off the toilet. So slowly start to integrate some of this stuff. Understand what pain means. Pain does not always equal damage. So again, pain in the muscle, that's a good thing. That means you work that muscle. Pain in the joint is a time to kind of stop and reassess. Measured progression. So again, slow and steady. The great thing about Parkinson's is we have time. So you don't have to get to that 30 minutes of 7 to 8 in the next week or two. If we can get there in the next couple months, I'm happy. Avoid acute pain exacerbation or have a plan. So sometimes, I'll talk to patients about if something were to happen, what are you going to do? What are stretches that you can pull out of the bag? Are you going to use ice? Are you going to use heat? And then obviously coordinate medication management. So trying to maximize your on time when you exercise is going to help you get the most bang out of your buck. Though I realize sometimes that's challenging. So the take home, what type of exercise should I do? The exercise that you will do, the exercise that you enjoy. Ideally, you're doing something from each of these 4 bins. So you're doing aerobic, you're doing something to make you strong, you're doing something to keep your flexibility, your range of motion, and you're doing something for balance. But intensity matters. Just doing something for the sake of doing something may not be doing enough. And again, kind of the review, why are you exercising? Hopefully you guys kind of have an answer for that. So you're exercising for Parkinson's, but also for your body in general. Hopefully you're exercising for you and not necessarily for your care partner that's watching this with you. I hope you have an idea of specific exercises that you could do at this point in terms of the different modes of exercise. Now, in terms of what you're going to do is what you have to think about. And again, Nate can kind of talk about that a little bit as well, a PDF and email it out to people. Nancy's nodding. So this is something that Lori Keene and I put together a couple years ago for WPC, though I'm not sure it actually ever went out. But this was just kind of a nice checklist, and I updated it with the kind of current recommendations of different options of cardio, strength, flexibility, and balance, and then kind of some caveats to that. So theoretically, if you printed it out, it could be like a 2-sheet back and forth model.
I can.
Loud and clear. Jenny, thank you. That was awesome. That was really good. And I like listening to you talk because it helps me and it reinforces what we do. So thank you. That was great. I was like, I got a lot out of that.
That was jam-packed. So I'm sorry if I went quickly. And again, hopefully you guys can get the slides. I saw people kind of vigorously writing. But yeah, we can go over questions at the end too.
I thought it was awesome. So thank you very much. So hello, folks. On the second half of this presentation, my name is Nate Coomer. Like was said earlier, I'm a physical therapist. I don't get down to the Oregon area very often, but I am very close up in Seattle, and I'm really thankful to be able to talk to you guys today. And so when we first started talking about this, Nancy had kind of talked about doing something with apathy, because it is fitting. This year has been awful. And so I've seen it as a therapist. I've seen it as a parent. I've seen it as from my child's eyes, being homeschooled, being stuck inside. Apathy has crept in all of our lives, and not specific to Parkinson's disease. This has been one of the hardest years for all of us. And so I've given a couple talks on, ways to try to work out of it. And now I kind of feel like there might be some light at the end of the tunnel, which is great. I'll skip past this initial slide. And hopefully it can be a little more upbeat this time around as I talk, because in past presentations, there was no light at the end of the tunnel. And so we were all kind of stuck trying to figure out how to work out of it. Life really has changed, even though there's a few more resources out there, and things are some ways, at least up here in Seattle, and I know across the country, kind of starting to feel more normal. I think a lot of classes are still trying to figure out how to get back into the routine, how to do it the same way they used to, or, we had up to 7 exercise classes a week we were doing before the COVID hit. And we have not been able to get back to any of them in person yet. And we're just now putting together some plans. And I know comfort level, getting back into exercise programs and things like that is also um, a big thing. So there's been this loss of routine, loss of social interactions throughout the year. We've used Zoom. We've tried all these, interesting ways to stay connected, but there's nothing like being around other people, whether it's in a support group or an exercise class or a PT clinic or a doctor's office, and seeing and talking through the issues that you're having. So that's been tough. Um, and like I said, the loss of our community, the PD community, really, it's been hard. There is so much research to support the benefits of group classes, group work with Parkinson's disease, to keep us all motivated and keeping going. That this year will be a research study for years to come on how it impacted people with Parkinson's disease. So, this is just a perfect time now to start talking about how to deal with everything that's happened over the last year, and kind of hopefully build some ways to come out of it and get back to the routine of exercise that Jenny was just talking about, that many of you probably had before all this happened, and may have kept it up over the past year. But I know just from our clients coming in the building now, a lot of people have had to change and fallen off with their routines. So, um, you know, like personal experiences, you know, this kind of goes in line with what we were talking about before, but just, I've had the loss of my workout buddies. I used to run in a running group in the mornings, and we've had to put that on hold. We've just gotten back to it. Changed in my routine with, I used to have a gym that I used to go to as well. Not being able to go there anymore. It's been hard for me, and I certainly understand everybody is probably going through it. And that change is also very fatiguing. Having to completely adapt to everything new that's going on around us is tiresome. I saw it in my kids, like I said, when they had to go to homeschool. I saw it when we had to change around the clinic over and over again to try to keep it safe and spaced out and keep people coming in. It is very fatiguing for anyone. And so, along with that comes apathy. Um, apathy may, it's a term we use with Parkinson's disease, but really just the definition is a lack of motivation, reduced goal-oriented behavior, and decreased emotional expression. And you can understand how when apathy starts to creep in, it would change our exercise routine with all the research that's been shown for intensity and consistency. Everything that Jenny was just talking about, it's really hard to keep that going when you don't have anybody to push you and you're not able to be around others that are all driven. It's understandable that apathy would creep in. And the first thing I want to say is, don't feel bad. It's understandable at this point in time. And now it's all about how do we work together to get us all back onto our routines. Apathy is one of the most common non-motor symptoms, along with fatigue and depression, and they all kind of go hand in hand. And so we know we have a higher likelihood of having apathy with Parkinson's disease. This year has just really set it off even further. There's likely part of the reason that apathy creeps in is because, dopamine is kind of our reward and motivation, is linked to reward and motivation in our brain. And so when we have a lack of dopamine, obviously our drive and our motivation to keep going and keep moving and keep doing productive things goes down. It affects almost 40% of people with Parkinson's. So 1 out of every 2 people, close to 4 out of every 10 people with Parkinson's are going to deal with some apathy. And I find this, interesting, as this year has been the year of Netflix and binge watching and everything else. Those folks that are apathetic, everybody was watching more TV, but apathy, and this year has really allowed those that are apathetic to totally take advantage of it and probably watch more TV than they ever have before. We need to change that. We know that living well with PD involves a few very important things: strong social connections, active daily routines and schedules, and consistent exercise. And I think all of those things go together very well. You know, exercise allows for routine and schedules to be made. Exercise allows for strong connections to be made when we're exercising in the community, and we need to get back to that. This picture was obviously taken before 2020, but it's beautiful because you can see how everybody's talking to each other. There's connections being made, and hopefully we can get back to that at some point soon. So living well with PD involves these three things. The longer we're sitting on the couch and apathetic, the less healthy we're living, plain and simple. And so we've kind of come up with a rags to riches type of approach to dealing with apathy. And it's just some simple ideas. There's, you know, nothing special about what we're doing. It's just hopefully giving you some ideas that you can use and take with you after today to try to get back on track. So we've got, you know, building a routine, finding some way to stay accountable, setting realistic goals, and seeking out support when we need it. So the first tip and some ideas around it, we know what holds people back when it comes to keeping up exercise, and one of the biggest barriers, or some of the biggest barriers is a perception of lack of time. So we feel like we've got, I was giving a talk earlier today, and one of the participants was saying, "Oh, my daughter just had her vaccine. Yes, I was going to work out in an online class at 8:30, but my daughter called at 8 o'clock, and she was having a bad reaction to the vaccine. So I got online and ordered her a bunch of stuff to keep her, you know, comfortable while she's getting better. And then I missed my class, and then I had the chance to walk with a buddy later, but I had a dog that had some issues, so I had to go to the store, and so I just haven't done my exercise." And we have all these. We really have a very good ability when it comes to exercise. Everybody in general of finding excuses, and building in a routine is one great way to reduce those perceptions of lack of time. If it's part of your weekly routine, you no longer you've already built it in, and you no longer have. It's a lot harder to build those excuses or make those excuses around it. Um, there are other barriers that were found in this article that hold people back from exercise. Feelings that a person won't succeed, and this goes back to Jenny's point about starting slow. I think a lot of people are overwhelmed by the amount of research that's out there on exercise. First and foremost, there's so much research on exercise for Parkinson's, and so many people feel like, how do I do it all? I have to do it all. I have a lot of people that come in after they've been diagnosed, especially in the first 6 months to a year, and just feel like they need to tackle this disease with exercise. And there's really a feeling of being overwhelmed that comes on when you see that there are so many different avenues that have shown to be effective for exercise, and what's the right one for you. And hopefully Jenny's talk gave you some really clear guidance on setting some rational and easy goals. 150 minutes, I think, is a great goal. I love saying that because it's achievable. It's something we can start off with. So I wanted to leave you with that, knowing that there are specific things that we can all set our minds to today to get back on track, no matter how small they may be. But that feeling that we can succeed, and we don't have to be overwhelmed by this. And then fear of falls and balance also hold people back when it comes to exercising with Parkinson's disease. And there are great ways that are safe that we can also get back to working out, and not have to worry about those falls. But that perception of lack of time, I think, is big, and building in a routine makes huge sense. And it's really, I think, the number one building block if you're somebody that's been dealing with a little bit of apathy in the past year and trying to figure out how to get back on the horse. Even if your classes are shut down, we've got to figure out times in our daily schedule that we are going to commit to working out. This goes back to when the start of the pandemic, I didn't know what was going on. We had to shut down the clinic for a while because we weren't sure of what our guidance was. My kids had been, sent home from school, and we were finding ourselves staying in our PJs till 11 o'clock in the morning, 12 o'clock in the morning. We lost our routine. I used to be up at 5:30 every day, and I was sleeping until 9:30, 10 o'clock. I didn't know what else to do, and my kids didn't either. They were walking around the house trying to watch cartoons on Tuesday till like noon, and you lose that routine, and everything else falls apart. So we start this. I found this out the hard way. We started off. We realized soon, like, we just can't keep doing this. So we made it a point to wake up every morning and take the same walk that we would walk to school with at the same time that we would go to school. Every day I drop off the kids. And so I would get them up at 6:45. They would take their showers. We would eat breakfast. We'd walk up to the school and back down. And then those walks became more, I was off for about a month and a half without really treating. So we started to take longer walks. But every day we had a walk, and we had to walk 7:30, 7:45, we were out the door. And then that got us back. We started the online class, and it got us back into a routine. So I learned that I think personally, how important building in a routine is. Setting a time. This is my time to work out, and we know that building habits takes 20 to 60 days, 1 to 2 months. So it's not an easy, fast process. But if you set that time and say, I'm going to commit to it, makes it all the much easier to stick to. Much like Jenny gave a grid for exercise and committing times with strength, cardio, balance. We did something this January to try to get our Daily Dose users, which is our online platform, back on schedule. So we made a promotion. We said, you'll get a free month and a T-shirt if you can show us, like, your vaccine card. If you can write down on your 30-day challenge, we just made a calendar 30 days and said, just write down what you did every day. I don't care what you did, but write down that you did something for 20 to 30 minutes. Okay. It could be balance. It could be Tai Chi. It could be aerobic. It could be boxing, a walk, whatever it was. Let's stay active for 30 days. And that was amazing. People wrote in and were like, one lady lost like 15 pounds. And she just was like, I just needed that one thing to set me off, and I just went for it. And other people were like, yeah, I'm going to do another 30 days. So it can be simple. It doesn't have to be super complex to get you back on track or to get you out of those PJs. Jenny talked about how exercise can help sleep. I think building a sleep routine is also very important in continuing with your exercise. If we're going to bed at all hours of the night and waking up at all hours of the morning, we're totally off rhythm. And I think it might even be, I'm going to get into a good sleep routine this week, and then I'm going to build my daily routine afterwards to build my exercise. We talk a lot about working with your med cycle to optimize workouts. A lot of people, there's good research to say that working out is most optimal or most effective when we're in our on cycle. And so, if we're trying to get back into a routine, trying to find those times during the day when we feel our best will probably help us work out at our best and most intensive as well. I have online offerings throughout the week. There's been, this year has brought on so many offerings. I'm sure, Nancy, I'm sure you guys have online offerings now. I know the nonprofits up here, APDA Northwest and Northwest Parkinsons, have also done a great job of bringing everything online. So I have, a couple blurbs in here about checking in with Pro about their online schedule. I know you have it on your website, but that's another great way to say, okay, Tai Chi's at 10 o'clock. I'm going to commit to that once a week or twice a week. And that's how I'm going to start my daily routine. This is just a print off. I can send this to you too, Nancy. This was for our online community, but it's very simple. But just rewarding yourself by writing it down every day. And then we even encourage people to give themselves a treat at the end of the 30 days. Maybe you go out for ice cream, whatever it may be. Maybe you go out for pizza, you go out for, a nice dinner, or reward yourself, treat yourself. But give yourself those 30 days and just mark it down, just start there, slow and small, and building back to bigger and better. So the other point, accountability. We've done this, we lost our workout friends. We had a class, every class we had community in it. We didn't have large classes, 6 to 10 people, but everyone had friends. And I watched those all kind of break down this past year. But what we have seen that's been really nice is we've actually started to grow back with these workout buddies. So if you have a friend, the online platforms are really helpful. If you have friends all over the country, I'm from Indiana. It's nice to know that I could, if I needed the help, I could reach out to a friend or family member back in Indiana, and we could work out at the same time together in Zoom and work out that way. So that's something to think about. And I think even if it's, challenging somebody to walk with you every day or 2 times a week at home, or, having somebody that you're accountable to work out with is important. And, think about, as you might start to try back into some of these exercise classes, finding a workout buddy that you can be accountable to, whether it's online or in person. We had a great experience. We had a few members that were having trouble consistently working out from home, because it's not like working out in a class in person. One of them is Chris, and we have another member down in Olympia named Sue. She's like the greatest online exerciser ever. She's every day she's there. And we challenged Chris and Sue to make a pact that they had to work out together, because Chris just wasn't tuning in, and she was a regular member at our class in our gym. And so they made a pact that 3 times a week they were going to get into the Zoom room early, talk to each other, and create some accountability. And it's been awesome to see Chris stay with it. So you might have a class or 2 that you're already doing, that you might ask the instructor, even if it's online, to say, is there any way you could reach out to the group and maybe help me find an accountability buddy or a workout buddy? That, you don't have to be best friends, but if you say to each other, we're going to be here every day, it's more likely that you're going to show up. Friends and family can also support with this. Like I said, online classes can be social. It's been a weird year for us all to learn how to use Zoom and everything else, and it's not the best. But we've seen it work really well in our online exercise program. And now, as we start to get back into hopefully some more and more forms of in-person exercise, I challenge you to make agreements with other class members to stay accountable to each other. It gives you that drive that you need to keep going. Setting realistic goals. This is our S, or our G. This is G. This is the RAG. This is the rag of my rags to riches tips. So 150 minutes a week. I love the 150 minutes a week. I just feel like it's attainable for somebody that's trying to get going. And a lot of people are just trying to get going. Now, some folks are going to do 350 minutes a week and have no problem doing it. But this is 20 to 25 minutes a day. Let's start slow. Maybe it's 5 minutes a day. I have a client that's trying to get up to 25 minutes of biking, and we started at 5, and now he's regularly doing 15 to 20. And this has taken a month or 2 to get up to. But starting slow and building from there is a great way to start and not be overwhelmed. So setting that 150 minutes a week goal, I think, is a great way to start out. Counting your minutes, maybe use that 30-day calendar and you count your minutes every day. You just write down how many minutes you did and make sure that they add up to that 150 minutes. And that's rewarding at the end of the week. Trying the Parkinsons, the pro event calendar. I'm a big fan of your resource calendar, just to get people unstuck. If you're feeling like you're stuck in the routine, if you're not enjoying your workout, like Jenny said, you're not going to stick with it. And we have to be consistent. That's the biggest thing, is staying consistent over time. And so using something like the Parkinson's resource calendar would be a great way to find something new, try something new, and see if it sticks. If you start to enjoy something more, even better food for your brain, and you're going to stick with it. And then one of the bigger areas that I think doesn't get talked about a lot, I didn't realize I had 3 Ps in support, is to seek out help if you need it. I think a lot of people are dealing with the same feelings of apathy and depression and fatigue and aren't able to express it or don't feel like they have the resources around them to talk about it. And being able to openly talk with somebody about how you're feeling and that you're not feeling right, you're not feeling motivated, can really help to get out of that hole that you might be in. So talking to somebody, usually using counseling, I think, I'm gonna shout out to Pro. They got all kinds of great resources up there. And they have a helpline that you can call and get help and try to figure out how to build back better support systems to help you stay consistent with exercise and get yourself back into a routine that matters and that helps you. I think this is an area that is underutilized. We talked about psychologists, social workers that deal with Parkinson's disease are so beneficial. We have some resources up here that I rely on every week for patients that we treat. And there's a lot of great resources out there to help people with Parkinson's, but sometimes it just takes a phone call to learn what's available. And you don't have to feel like you're alone in this. Like I said, 40% of people with Parkinson's deal with apathy. Rely on your community resources to help you deal with it because they probably have some experience. And then, I always will put in my plug for a PT. I think we're the best place to start. If you're someone who has not historically exercised, or even somebody that has historically exercised, and you start to have symptoms with Parkinson's, you may not quite understand, or you may not, it always benefits to have somebody look at you with some experience and realize where those symptoms are most prevalent and help adjust your home program to really focus on those areas. So working with a PT can not only do that, kind of customize your own program, but also it's an accountability buddy. You've got to come in and sign up for PT, and you can generally use your insurance, and there's somebody there waiting for you. And I'm going to be mad if you cancel on me or don't show up. And you know that, and you're going to feel guilty. And so you're going to come to your therapy session. And after you start hanging out with me, you're going to say, I kind of like that guy. And then I'm not going to cancel anymore. And then you're starting to work out, right? We're starting to build that routine. So it's as simple as that. I'm an accountability buddy, and I bet you have an accountability buddy wherever you're living. So I always put up the powerforlife.org. They have a directory of PTs that have been licensed now or certified in Power. And I really feel that if you're certified in Power, you're probably committed to Parkinson's and physical therapy. I put up this powerforlife.org. Their website, to me, there's a lot on it. But they're a great group of very passionate people. And if you're having trouble finding the directory, just go to contact us, and you can call them today. It's a small group of people, and they can tell you, if you tell them where you live, they can connect you with good resources. The other place, I'm sure Pro also has great resources to help. Jenny, you might even in the Oregon area have good resources that people could use to find a PT that's local to them that would have some Parkinson's or neurological experience?
So usually I'll suggest the Parkinson's Foundation. So they have like centers of excellence, in which case I would just use a center of excellence here in Oregon. And they put on I think it's a 3.5, 4-day course for PTs, kind of from an interdisciplinary model. And they keep track of all the PTs that have gone through that. So if you go on their website, you can see who has gone through that and find a PT near you as well.
And if they're listening to the research, they're going to be pushing you while you're in there. And it's not just going to be a PT session where you're standing on foam and turning your head for 45 minutes. You're going to be working and moving big and working on intensity and learning what that feels like. And that's a really good place to start. Now, what type of exercise is the best place for you to start? Sorry, I'm jiggling my screen. I'm so excited. Group, individual, PT, or home programs. So we have somebody in this room that did this research. Jenny, this is great stuff. So the boot camp was it was kind of a boot camp that was developed to kind of address the same areas that Jenny was talking about in her talk. And feel free to jump in at any time, Jenny, as we go through this. But they provided it in all three settings, whether it was a group class, individual physical therapy, or a home program. And they did it 3 times a week for 4 weeks in all 3 settings. Correct, Jenny?
Yep.
And so the requirement was that if you were working out at home, you were to follow these exercises. If you came in to see a PT, the PT would run you through the exercises, or an instructor would run you through the exercises in a group class. And they wanted to see what was most beneficial and where people improve the most. So the individual classes, the PT, like one-on-one PT, showed the most benefit for balance and improved function. And like Jenny said, if you're working on balance, it might be best to do that in kind of an individualized way so that you get the most bang for your buck. Because I've seen that in my practice is, you can usually push people harder when you have somebody guarding you. You can keep people safe. And if balance is one of those areas that you really have trouble with, individual classes seem to be the most beneficial. Group classes showed benefits for gait that individual classes did not, which is a bummer for a PT like me, but it's awesome to see that you can improve walking in a group class. And the home program did show some improvement, but the least amount of improvement. Am I right, Jenny? So
yeah, and part of this also looked at comorbidities. So especially people that had a lot of stuff going on. So a lot of pain issues, a lot of other medical diagnoses, a lot of cognitive issues. Those people did not do well at all in the home exercise program. And I think part of that is, again, there was no accountability. You came in, you saw us once, we gave you a packet. You knew you're going to be tested again in 4 weeks, but there wasn't any of that follow-up versus coming in and seeing us 3 times a week.
And that's, it was depression, BMI, number of medications, disease severity, cognitive impairment. So, having somebody in an individualized setting, we can, address and adjust the exercise or therapy depending on those comorbidities. So if you're somebody out there that is dealing with some of those things, you might consider finding a PT first and working with them in an individualized setting, as opposed to maybe trying to do things at home. And I think a lot of times I'm somebody too that I may seem like an extrovert in here, but when I'm at home, I'm very much introverted. I do not like trying new things. It's very difficult for me. My wife would tell you that. And so if I was given the choice of doing something in a group setting or doing it at home, I'd probably go for home right away. I don't like to be in a crowd. So, but knowing these things is very important to know that it's probably much more beneficial to be out either in a group setting or in an individualized PT. There's more benefit, and we push ourselves more when we're around other people. We all understand that. It's much easier to be kind of self-select your intensity level when you're at home by yourself. I know my workouts at home are pretty pathetic. So, we want you to understand that there are different levels, group classes, individualized PT, home programs. So, thinking about these things and what individual impairments you might have, whether it's gait, balance, functional deficits, might lead you to the area that you might want to seek out as much as possible. And I know this year has changed a lot with home programs. I mean, this has actually been a year where we've been able to use a product like Zoom to guide people with telehealth and telemedicine and group exercise classes and things like that. So, you know, it is an avenue that I think has um, more uh, more benefits than or it's come a long way in the last year. I would say that we now, using Zoom, we can be in a group format and interact, as opposed to, as a therapist for many years, just giving people a piece of paper and telling them to go home and do these exercises. That was part of my frustration uh, as a PT. So you know, there are group classes that have been beneficial and gotten us through this time, but I would encourage anybody, if you do have those opportunities to get into an in-person setting in the coming months, to seek that out. And working with the Parkinson's Resources of Oregon can help you find those classes and PTs and everything else in between. So I don't want to steer you wrong. Make sure you check out and talk to Nancy, call her 1-800 number and get some resources. I'm going to put my email up there. You can ask me any questions. Disclaimer, I probably, between my kids, Little League Baseball, my work, I might take a few days, but I'll get around to them. So if you have any questions after today, feel free to write me an email and let me know. So the phone number you might not have as much luck with, but an email I'll get to.